Hello, everyone. Good afternoon. I'm Sayukta from beautiful Spotless Skin team. I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown colored patches on their face. They seem like freckle like spots forming large flat patches. This is nothing but melasma. Melasma is a common chronic skin condition in India. According to study conducted across 4 Indian cities reveals that more than 80% of the population present skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone more prone to pigmentary disorders. It occurs mainly in women and men's are also, 10% of males of all ethnic and racial groups are affected by it. Around 20 to 30% of 40 to 65 years old women present a facial melasma. Melasma and hyperpigmentation generally ignored as sign of aging and often misunderstood skin condition. Melasma sufferers have been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustrating setback in treatment. To avoid all these hazards and to keep you informed, today we are here to know more about management of melasma from an expert. So let's connect today with our skin expert, Dr. Jaspal Singh Saluja, a dermatologist, cosmetologist, and hair transplant surgeon live from Bilaspur to make us aware on management of melasma. Dr. Jaspal is a founder and director of Saluja Skin Clinic in Bilaspur, which is the first hair transplant center in the district. Dr. Jaspal is renowned for facial aesthetics, excellent injector skills, and surgical and non-surgical cosmetic medicines. Today, Dr. Jaspal will share with us his expertise on management of melasma. It's so wonderful to have you, Dr. Saluja. Welcome, and I'm sure you're having a good time.
Yeah, thank you for the kind introduction, and I'm thankful to the team for inviting me for this talk. And yes, melasma is a very common condition, and I would say the maximum number of cases we do see as a dermatologist in a routine practice is more of melasma, and generally people seek treatment for it, but they usually roam around from one place to another, but they could not find the exact management of it. But before knowing that, they have to know why it happens and why it occurs and what can be done to reduce it.
Exactly. So in today's session, we'll try to cover it all. So start with, Doctor, what is melasma?
Melasma is basically pigmentary disorders. So basically, pigmentary disorders are divided into two things. One is hypopigmentation, that means the white patch or the decrease in discoloration of the skin. And second is hyperpigmentation. So melasma is basically a hyperpigmentary disorders where you see patches of brown macules over the sun-exposed areas of the face. It has to be on the sun-exposed areas of the face, and its distribution is basically symmetrical as in both sides of the face or both sides of the heads or both sides of the mandible or the cheeks will be affected.
Okay. And it is quite common in our country. We see a lot of people, especially women, having melasma. We would also like to understand, doctor, what causes melasma?
So melasma is basically dependent upon two important factors. One is the genetic predisposition. Someone is the family must be having it. Obviously, the females or the progeny of them will be getting the same. It is not at all compulsory that the offsprings will get the melasma, but the likelihood chances of melasma is more in them. Secondly, is the sun exposure, which usually happens, and especially the climate of India is such that it actually makes the skin more susceptible to melasma pigmentation. The other factors, the nutrition, the dietary factors, the oral intake of certain tablets, for example, the hormonal pills, the estrogen-derived pills, certain ovarian cancers also can lead to melasma, and especially the shift and balance between the hormonal imbalances which occurs generally can lead to melasma.
Okay, so there are so many causes that can be responsible for melasma. You also mentioned hyperpigmentation. Even during our introduction part, I said that, hyperpigmentation, melasma, they are so common. But we would like to understand, because as laymen, we don't know whether they are different or is it the same thing. So we would like to understand, is there a difference between melasma and hyperpigmentation, doctor?
Yes. So hyperpigmentation is a broad terminology in that various causes of it occurs. One of the cause of hyperpigmentation is melasma. So melasma, you can say, is actually a subtype of hyperpigmentation, which generally people forgets and they say one and the same thing, and they seek the treatment for every hyperpigmentation condition, and they thought that the treatment of every hyperpigmentation condition is just the same, which is actually theoretically and practically is not correct.
Right. So melasmas can be, understood as a part of hyperpigmentation. All melasma can be hyperpigmentation, but all
All.
hyperpigmentations can be
Yeah.
melasma, right?
Yeah.
Okay. Now, you have already told us how does melasma looks like. But still, doctor, for better understanding of our viewers, we would like you to again explain the symptoms or signs. Mostly, I think these are the signs that are, visible on the face. Please shed more light on that.
So melasma is basically occurs on the sun exposed area. I mean to say sun exposed areas of the face means the prominent areas of the face. If you see, especially we see melasma on the cheeks, the forehead area, or the mandible or the jawline areas of the face. But sometimes in very, very rare cases, it can be seen on the anterior part of the chest as well as on the dorsum of the hands also, but that is very rare. But generally, we see melasma on the sun exposed areas of the face, and it is slightly brownish, macular, or patchy pigmentation, which you see specifically on the cheeks area, the forehead, and the mandible area. That's why it is divided into three categories: the centrofacial areas, where you can see melasma or pigmentation over the forehead, the nose area, the cheeks area, the upper lip area, as well as the chin area. Second is mandibular, where you can see just on the mandibles of the, or I'll say the jawline area of the face. Third, which is actually the malar area. Malar means the cheeks area.
Mhm. Right. We have also seen a lot of people, especially again women, with these freckles or we can say patches on their cheeks and nose. So yeah, it forms a W kind of a structure, and many a times they are so ignorant about it. They feel that it comes with age, and as I'm aging, I'm bound to have this. So there is no remedy of it. So we'll talk about it as well. But now, if we talk about the risk factors for melasma, doctor, are they going to be the same as the causes? As you stated, whatever the causes of melasma can be, is again the risk factors?
Yeah, the risk factors is basically what we see in Indian scenario is generally during the pregnancy or just after the pregnancy, because there is hormonal shift in that. Then you can see melasma more, especially in female, because it is basically a female hormones derived pigmentation. Like I already said, that it occurs because of the genetic as well as the hormonal issues. Second, certain I already mentioned about the tumors, especially the ovarian tumors, can lead to it. Women who take oral contraceptive pills, in them definitely it can happen, but not always. People who take anti-epileptic drugs, that means जिनको मिर्गी के दौरे या आते हैं, in certain medications also they can get these kind of pigmentation also. So these are some of the risk factors where yes, the preponderance of melasma can be more.
राइट कई लोगों को लगता है कि मुलाजमा सिर्फ उनके अपीयरेंस को अफेक्ट करता है, इसलिए वो उस पर ध्यान नहीं देते, लेकिन जिस तरह से आप बता रहे हैं, मेरे ख्याल से डायग्नोसिस या उसका ट्रीटमेंट इसलिए भी जरूरी है, या एक बार डॉक्टर को दिखाना इसलिए भी जरूरी है। अपीयरेंस तो एक चीज है, लेकिन हो सकता है कोई अंडरलाइंग कंडीशन भी हो सकता है, कोई हार्मोनल डिसबैलेंस की वजह से हो रहा हो, या आपने जो दूसरे कॉजेस बताए, स्पेशली इन वुमेन। तो ऐसे में बहुत जरूरी हो जाता है डॉक्टर कि अगर मेलाज्मा है, साइंस दिख रहे हैं, तो हम एक डर्मेटोलॉजिस्ट से जाके मिले।
Yes, definitely. Because in skin, people generally neglect until and unless it pains them or it affects their actually the day routine life or the lifestyle of it. But in skin, especially certain skin pigmentations, one of them is obviously the melasma, is one of the indicators that can actually indicate you that it is not just the pigmentation, there must be something underlying to it.
Mhm. Right. So it's important to consult a doctor, qualified dermatologist, in case you see any patches, freckles, etc. Now, doctor, how do you, as a doctor, diagnose melasma? Is it just by seeing you can say that, okay, yeah, this is melasma, or you need some tests or scans, etc.?
Yes, mostly because we see a lot of cases of melasma, we do have that ability to just judge it out from a distance also. But yeah, there is a instrument called Wood's lamp. Through that, we can judge it out the type of melasma, because according to that only we can decide how much of the melasma pigmentation can go off. So it is divided into two. One is epidermal and second is dermal. Epidermis means the upper layer of the skin. Dermal is beneath that. Obviously, beneath the dermis is actually the subcutaneous tissue. There, obviously, melasma does not happen. So it's basically epidermal type or a dermal type. So through the Wood's lamp, we can definitely make it out where the melasma is, what is the depth of the melasma, and according to that, we can do the treatment of it. So if you do Wood's lamp, because we do it as in a routine part, just to judge it out whether it is melasma, it is dermal or epidermal. So in Wood's lamp, if there is a dermal component more, in Wood's lamp, you see basically the pigmentation is little lighter, but in epidermal, because it absorbs light, through Wood's lamp, the pigmentation becomes little dark. So this is how you can define it is an epidermal or a dermal type of melasma.
Okay, now let's come and talk about the treatment part of melasma. How do you treat melasma, doctor?
So as soon as a patient arrives in my clinic, the first thing which I always ask to my patients, because you have already mentioned that people in India experiments a lot with their faces and then they come to a dermatologist. So my first question to them, once the diagnosis is made that it is melasma, I always ask them that whether you have taken any sort of treatments, be it from a dermatologist or a non-dermat, or through the pharmacies they have taken any kind of creams which must they have applied to reduce it. I ask them first the history of this, and if they have applied something which actually changes the appearance of melasma or worsens their condition of the skin, I repair the skin first and then treat the melasma. So my first would always be what all histories of their treatment is there, and then I go for the treatment of melasma. Now, once this is confirmed, and if the patient has applied something which generally people applies routinely, and I see a lot of my patient must have applied before coming to my clinic, they generally apply a cream called steroid. Steroid, if they apply topically for a longer duration of time, it actually depletes their skin and वो skin को थोड़ा सा पतला कर देता है. This makes the skin more susceptible to pigmentation. And that is the reason when they stop that steroid cream, they get more of melasma. So this is one of the dangerous signs or the aggravating factor that why melasma increase more in the Indian scenario because of the availability of these topical steroid creams. So I repair that skin first with the help of moisturizer. Moisturizer is a must, because it is not just only the pigmentary treatment, we have to repair the skin also. Second, which is very important, is sun protection. Even though women who work at their home, this generally says, मैं तो बाहर ज़्यादा जाती नहीं हूँ, I don't go out in sun. But it is not just about the sunlight, it is about the ultraviolet radiation, which is there in the sunlight, even though you cannot see the light, but the radiations are there, which actually provokes the melasma more. And thirdly, most of the Indian women are housewives. They generally do work in front of the gas chula or a burner or something like that. Obviously, the heat of it sometimes provoke the melasma. So avoidance of these factors is a must. and sun protection in the form of sunscreen application at least twice or thrice, because we all know sunscreen doesn't last longer. It lasts for only 2 to 3 hours. You have to reapply once again over the first layer, over the second layer, just to prevent the further progression of melasma. This is very, very important. So I always say prevention is always better than cure. So preventive measures would be my first line of management.
Right. I was about to talk about, the prevention thing that we can do to prevent melasma at the very first spot. Now, my question again is that only prevention, and as you mentioned, sunscreen. Please, we would like you to elaborate on that. How we can prevent melasma.
So one, I already mentioned that sunscreen is a must thing, but sunscreen has to be applied according to skin type, because mostly people buy various n number of cosmetic sunscreens, which actually doesn't work, and they don't know about it, which ingredient works more. There are few reports which says visible light sometimes provokes melasma, but that is not whole 100% true. But there are sunscreen for the visible light protection also. There are n number of brands which actually make sunscreen to prevent it. Sunscreen has to be applied according to the skin type. That is one. Second thing, whenever they go out in sun, even they go to their angans or their terrace for any work, household work, they should cover their face or they should wear a hat, so that prevention from the sunlight or the radiation should be there. Thirdly, the prevention is please do not apply any kind of cream without the supervision of a dermatologist. These three things is very, very important, because if these three things are done, most of the melasma fades off on its own.
Okay.
Yeah.
So fair enough. These three things are what we need to do to prevent melasma. Now, as you mentioned, sunscreen and the importance of sunscreen in the daily care routine. My question to you, doctor, is that as you said, many people have various kinds of excuses or complaints regarding sunscreen, and thus they are not using sunscreen as a daily skin care routine part. Now, the thing is that amount is also important, the amount or adequate quantity of sunscreen that you are using. You also mentioned reapplication is very important. Choosing the right kind of sunscreen as per your skin type is again very important. Now, of course, the option is that we go consult a dermatologist and get the best cream or sunscreen for us as per our work routine or skin condition. But you will also agree with me that many of us don't go to the dermatologist at the very first stage. So now, as you are here, and this whole platform is about raising awareness regarding, melasma or the management of melasma and usage of sunscreen, we would like you to elaborate a little more on how to apply, what is the adequate quantity, how often to apply, and keeping in mind all the excuses that people give. Like, my skin gets very dull or patchy, or I sweat a lot when I apply sunscreen, etc.
Yeah. Yeah. So in book, it always says that the sunscreen has to be applied that 2 milligram per centimeter square area, but that is actually not possible practically. So the
Right.
best is obviously the finger count for the face. If you apply face or neck, 2 fingers is enough for the face as well as the neck. Now we are mentioning about the sunscreen. I'll also mention about sometimes, because we can include the sun tanning also. So for that also, if you apply sunscreen for the hands also, so there also for one arm you can apply 2 to 3 fingers. The linear sunscreens you can take, and that you can apply for one arm. And same as goes, I mentioned about the feet also. The same also 2 fingers for the 1 foot each. You have to apply sunscreen like that, and it should be a proper even layer, and it has to be repeated after 2 to 3 hours. Now, patient usually said, I do sweat a lot. In them, obviously, there are water resistant sunscreen. You should apply that, but every sunscreen has to be reapplied or repeated after every 2 to 3 hours.
Right. And I'll also pick few points that you just mentioned and try to understand them well. one thing, as you said, and that's actually the right thing, is that people in India experiment a lot with their skin. They'll either, acne or any breakout, they'll go and run for their kitchen and find something to put over it, home remedies, or they'll go to the chemist and ask for an over-the-counter, fixation or treatment, or they'll ask their family, friends, whoever had gone through the same thing to suggest what they can do. Dermatologists, which is very sad, comes at last. They are like their last resort, and by the time they reach the dermatologist, it's way more worse than it was in the initial state. So we would also like you to shed more light on this very topic, that how these home remedies, over-the-counter medication, as you said, they contain a lot of steroids, and asking a friend or family can actually worsen our condition.
Yeah. So over the counter, which I already mentioned, that over the counter steroid creams people generally use for n number of conditions. And due to that, they get a lot of side effects for that. One, which is very important, is thinness of the skin. Secondly, if you apply such kind of over-the-counter steroid creams, it can lead to hypopigmentation, which I already mentioned. That means the skin become whiter and whiter and whiter, which they feel is good initially, but later on then they realize it is converting into a white patch. Thirdly, you can see the side effects as such that you can see blood vessels through the skin. You can see through it because the skin becomes thinner. That is actually one of the dreadful side effect of the steroid cream. Fourth, whenever you apply such kind of creams, then your skin becomes more sensitive. Then whenever you go out in the sun, it itch a lot, it becomes red and swollen, and whenever you wash the face, it becomes too dry, cracked and chappy. So that's why I said moisturization application in such scenario is very, very important. Fifth, which is very important as far as side effects part is concerned, that sometimes in most of the scenario, I see patient came to the clinic with a swollen face, and that is actually the biggest disadvantage of using a steroid cream. This is called a moon face, and that condition, obviously, the steroid cream actually it through the skin, it absorbs and it goes to the bloodstream, and it actually suppresses our the hypothalamo pituitary center, which is the HP centers of our brain. And through that, what happens? The normal corticosterol levels of our body decreases. So this is how the topical cream actually indirectly suppresses our brain normal hormonal functions. So it is my request to all the listeners who please do not apply over-the-counter creams without the supervision of a dermatologist, because initially they see their benefits with just applying the cream, that they see that the melasma or the pigmentation has gone, but eventually it is actually causing minute changes in your body, which they realize later on once they visit to a dermatologist.
That was quite scary. Even I was not aware of so many things. And yeah, definitely, we need to be really careful and aware about the harmful effects or side effects of steroids. Now, the irony is, doctor, जब किसी से पूछो कि आपको कोई स्किन कंडीशन है, कोई प्रॉब्लम है, आप डॉक्टर को, डर्मेटोलॉजिस्ट को क्यों नहीं दिखा रहे हैं, तो वो कहते हैं, अरे डॉक्टर के पास जाएंगे, वो हमें स्टेरॉइड्स दे देंगे, और वो खुद क्या कर रहे हैं, वो ओवर द काउंटर जाके स्टेरॉइड्स ही ले रहे हैं, उनको पता नहीं कैसे यूज करना है. There's definitely a way, right? Because you as a doctor also may advise or prescribe steroids, but doctors का किस तरह से अलग होता है?
So generally for the melasma, yes, steroid is one of the treatment, but we use it for a certain duration. There is a formula called Klinsmann's formula. It's a triple combination formula, which consists of hydroquinone with retinoin as well as a topical corticosteroid. But it has to be used for a certain duration. After that, obviously, we switch over to some other depigmenting agents, which is actually for the maintenance of the melasma pigmentation so that it does not reappear. But the irony is, whenever we prescribe such kind of creams, they find it quite fancy and they find it quite helpful. And they keep on applying such creams again and again, again and again. And that's how they land into the side effects of it. So to be frankly speaking, as far as my experience is concerned, I generally try to avoid it. But obviously, if the condition is too severe, if the pigmentation is too deep, obviously we prescribe it for a certain duration and then we switch over to other depigmenting agents.
एग्जैक्टली द फैक्ट रिमेन्स कि जब एक डॉक्टर है, एक क्वालिफाइड डर्मेटोलॉजिस्ट है, उन्होंने बहुत पढ़ाई की है, बहुत साल अपने दिए हैं इसी स्टडी में, हमारी स्किन को पढ़ने में, समझने में, उसे ट्रीट करने में, तो डेफिनेटली दे विल नो कि आपकी क्या प्रॉब्लम है, किस तरह से उससे डील करना है, अगर स्टेरॉइड्स देना भी है तो कितना देना है, कब तक देना है। तो इसलिए प्लीज गो एंड कंसल्ट अ क्वालिफाइड डर्मेटोलॉजिस्ट। डोंट do over-the-counter medication, self-medication, home remedies, etc. Don't waste your time and all that. Go and meet the right person and trust your doctor. That's equally important. Otherwise, जैसा डॉक्टर ने शुरू में कहा था, एक के पास गए, फिर दूसरे के पास गए, तीसरे के पास गए, उन्हें समझ में ही नहीं आता, या फिर जो लिख के दिया है उसको उस तरह से फॉलो नहीं करते, कुछ अच्छा लग रहा है तो उसे हम महीनों महीनों तक लगाते जा रहे हैं। ऐसा नहीं करना है। Trusting your doctor is really important. Now again, a home remedy part, doctor, because many times, especially with melasma or pigmentary issues, people will say papaya लगा लो, skin पे अच्छा हो जाएगा, या कुछ और इस तरह के बहुत हम लोग home remedies करने में भी हमको बहुत अच्छा लगता है, और हमको हमेशा लगता है, एक notion है हमारे head में कि home remedies के कोई side effects नहीं होते. What's your take on that?
Yeah, to be frankly speaking, I, as a dermatologist, I'm not a big fan of DIYs as per se, and I'm not a big fan of home remedies. Yeah, obviously, people generally says that doctor prescribe a cream or a tablet, which is actually a chemical. But in fact, if you see, if I say to a patient or any person that you apply nimbu or lemon on your face, they'll say it is a natural thing. But if I say, please apply L-ascorbic acid, they'll say it's a chemical. But to be frankly speaking, you know that both of the things are the same. The only difference between the home remedies and the medicated creams is that in home remedies, you get a lot of n number of unnecessary things which actually cause reaction, or we say contact dermatitis on the face or on the point of application. As cut to on the creams, obviously, you know, this particular ingredient is important to reduce the pigmentation. That's why we always recommend to use the medicated creams. But I don't see any difference in them that the home remedies is good or a cream is good. I think both are same, but obviously you have to know the science behind it, why you're using a home remedy and why you're using a medicated cream.
Right. If I ask somebody to clean or wash their face with H2O, they won't. They'll go Google what H2O is. But if I just say that go and wash your face with water, they'll do it immediately. No second wasted. So that's the difference. You know, we are doing the same thing, but then we don't understand the actual difference. Now, the thing is, we are so scared of this term chemical. You mentioned about lemon or nimbu. I know many people who actually go and put nimbu ka ras on their face. They use, they literally rub lemon on their face, saying that lemon has this property of lightening your skin. Vitamin C has this property of lightening your skin. So they will just go and keep on rubbing nimbu on their face, and that actually burns their face. So that's the difference. And thus, we are continuously saying that meeting the right person, the qualified dermatologist in this case, is what you need. Don't risk or play with your skin. It's the largest organ of your body. Please have respect for that. I'll also quickly take some of the questions that our viewers are asking. Jacob Oliver, why does no product get rid of acne? Why isn't isotretinoin in shops? Is it a steroid again?
No, not at all. Retinoid is basically a vitamin A derivative, which is available in the pharmacies. But again, retinoid is also something which has to be taken under supervision because it has a lot of side effects. I don't want to scare my patients also, because I also prescribe it for the acne formulations. because the patient, I must guess it out, because he or she must be using the same. But I would say please get it under the supervision of the dermatologist, because it has a lot of side effects which actually shows up if you take it for a longer duration of time on your own. Apart from, if the person is, I think, mentioning about, apart from retinoids, there are other several treatments, the peels, the other antibiotics, the other topical cream, the skin care especially, it is very, very important. These are the four things which also helps to reduce the acne. But acne, since the acne, we all know that acne occurs because of two things. One is the hormonal factor, and second, the type of skin. That's why we generally see acne mostly in cases who have oily skin.
Right.
Yeah.
Exactly. So again, Jacob, you need to go and consult a doctor. Don't go and go for self-medication or over-the-counter medication. They can be really harmful for your skin. Paras Shukla is asking, which is more important, sunscreen or moisturizer? Can we pick one really, or both are equally important, doctor?
Both are important for me. I cannot pick one, because obviously you need repair as well as prevention, because the person is asking about which is important, the repair or the prevention. I cannot say one is important, both are important. Moisturizer helps to repair the skin, and sunscreen actually prevents it from the harmful radiations of the sunlight.
Okay, so you need both. And what should be the chronology or the order of application, doctor?
Ideally, the moisturizer has to be applied after face washing, or before the sunscreen, as per se, I'll say. And obviously, the sunscreen should be on the top, because you have to protect the skin. So the sunscreen should be on the top. Before sunscreen, you should apply a moisturizer. But for the reapplication of sunscreen, like I already said, you don't have to wash your face again until unless you sweat or you have dust or any kind of fomites on the face. You can reapply the sunscreen on the first layer of the sunscreen.
Fair enough. रूबी मल्होत्रा is asking, सर मुझे फेस पर ब्लैक एंड ब्राउन स्कार्स हैं जो पिछले 1 साल से नहीं जा रहे हैं, प्लीज कोई ट्रीटमेंट बताइए, और सर क्या मलाजमा परमानेंट होता है?
अब thank you for the question, Ruby ji. But for the answer of the first question, because she is saying कि face पे scar है, generally people confuse हो जाते हैं कि वो scar है या pigmentation. Let me be very clear. Scar का मतलब होता है खड्डा या जख्म, and pigmentation का मतलब होता है दाग. So I could not understand whether she wants treatment for the scar as per se or the pigmentation. ये चीज हमें जानना होगा पहले. And secondly, if what was the second question of us?
क्या melasma permanent होता है?
So like I already said, because melasma जो है वो dermal level तक जाता है, तो उसके जो रंग बनाने वाले सेल्स होते हैं या ग्रंथियां जिसको हम हिंदी में कहते हैं, वो वहीं रिसाइड करते हैं, वहीं पर बैठते हैं. नाउ व्हेनेवर देयर इज अ सन एक्सपोजर और अ रेडिएशन एक्सपोजर और अ हीट एक्सपोजर, इन सेल्स में वापस से एक्टिवेशन हो जाता है. ये जो ग्रंथियां वापस से एक्टिवेट हो जाती है, इसलिए ये वापस से डार्क दिखने लगते हैं. और यही एक वजह है कि मेलाज्मा वापस, या झाइयां जिसको हम हिंदी में बोलते हैं, वो वापस से क्यों दिखती है. इसीलिए सन प्रोटेक्शन करना बहुत जरूरी है. अगर आप करते हैं ट्रीटमेंट के बाद भी, टू जस्ट टू सस्टेन द रिजल्ट्स, तो मेलाज्मा रिपीटेटिवली नहीं होता. अदरवाइज अगर आप स्किन केयर नहीं करेंगे तो यस, इट कैन रीअपियर. ना अगर इसके हिसाब से अगर मेरा जवाब ये होगा तो यस, परमानेंट इलाज नहीं होता. बट इफ यू सी, देयर इज नो परमानेंट इलाज फॉर एनीथिंग. Fever also tends to come back if you have fever 6 months ago. But for the skin is something which is already exposed to the sunlight and every day उसमें exposure हो रहा है, तो उसमें हमें prevention करना बहुत जरूरी है.
एग्जैक्टली तो रूबी, आपको अपने सवाल का जवाब मिल गया होगा। अगर आप छत्तीसगढ़ में रहती हैं तो बिलासपुर जाइए, सलूजा स्किन क्लिनिक में डॉक्टर से मिलिए। बिलासपुर में रहती हैं तो बहुत इजी है। और आप जहां पे भी रहती हैं प्लीज एक डर्मेटोलॉजिस्ट से जरूर मिलें, क्योंकि ऑलरेडी आपने बहुत सारा वक्त जाया कर लिया है। और जैसा डॉक्टर ने कहा कि जितना आप डिले करेंगे उतना जो ट्रीटमेंट है वो और ज्यादा लेंदी होता जाएगा। डॉक्टर, ऐसे में कब हमें समझ जाना चाहिए कि अब टाइम है, दिस इज नॉट नॉर्मल, वी शुड जस्ट आई शुड जस्ट गो एंड कंसल्ट अ डॉक्टर? बिकॉज व्हाट हैपेंस, जब भी फ्रेकल्स पैचेस होते हैं फेस पे तो कभी कभी बहुत छोटे छोटे होते हैं, हमें लगता है अच्छा धूप में हम ज्यादा निकल गए थे तो मे भी हो गया है। कुछ ही दिनों में वो बहुत ज्यादा फैल जाते हैं और फिर तो वो इतना ज्यादा हो जाता है कि हमें लगता है कि अब तो हमने ऑलरेडी बहुत टाइम वेस्ट कर दिया है। So when is the time when we should get, concerned and alarmed and go and consult a dermat?
Usually, the answer lies in your question only, because whenever you see any kind of patch or pigmentation on your face or anywhere in the body, you should immediately consult a dermatologist, because generally you always ignore it by saying it कि यार ये थोड़ा सा तिल होगा, maybe it is because of age related, maybe because I'm not eating proper food, maybe I'm not taking proper sleep also, maybe my lifestyle is not good. But sometimes ignorance of such kind of things can leads to the progression of the disease. So immediately, whenever you see a pigmentation, whether it's a brown pigmentation, whether it's a black pigmentation, it's a bluish, red, any kind of pigmentation, if you see on your body or on your skin, you should immediately consult a dermatologist. Maybe it's not an emergency, but you should know about कि क्यों हुआ है, क्या उसके कारण है और क्या उससे बचने के तरीके हो सकते हैं।
एग्जैक्टली तो जितनी जल्दी हम जाएंगे, जितनी जल्दी पता चलेगा क्यों हुआ है, उतना ही आसान उसका इलाज हो सकता है। और उसको अगर हम रेस्ट्रिक्ट कर पाए तो डेफिनेटली और ज्यादा वो नहीं फैलेगा, ये भी कोशिश करनी चाहिए। इसलिए तुरंत डॉक्टर से जरूर संपर्क करें। अगेन डॉक्टर, एज यू मेंशन्ड बिफोर दैट मेलाज्मा कुड बी हेरिडिटरी एज वेल। मान लीजिए मेरे पेरेंट को है और मुझे अभी तक नहीं हुआ है, लेकिन मुझे लग रहा है कि चूंकि पेरेंट को है तो मुझे भी हो ही सकता है। तो ऐसे में मुझे एज अ प्रिवेंशन क्या करना चाहिए? क्या अर्ली एज पे जाके ही मुझे डर्मैट से मिलना चाहिए कि सी आई हैव द हिस्ट्री ऑफ मेलास्मा इन माय फैमिली, या मैं क्या कर सकती हूँ?
See, generally, which is little genetic, you can't prevent it as per se, but there are certain preventive measures you can do. First, which is very important, is skincare. We already mentioned about it, that importance of moisturizer, importance of sunscreen in them. Definitely, this helps to delay the pigmentation forthcoming. But yes, exactly, it does not prevent at all completely, but you can delay it. Like I always say, in aging also, you cannot prevent the aging completely, but you can delay it. Nobody is gonna completely prevent the aging, but yes, you can delay it. Delay means obviously that is the treatment what we generally seek.
Right. और इससे मुझे याद आया, क्योंकि मुलाजमा अगेन हम बार बार कह रहे हैं कि विमेन में बहुत कॉमन होता है, बहुत ज्यादा उनमें होता है बिकॉज ऑफ वेरियस रीजन। वन इज डेफिनेटली हार्मोनल इम्बैलेंस एटसेट्रा एटसेट्रा। नाउ द थिंग इज दैट जैसे सनस्क्रीन के वक्त हम डिस्कस कर भी रहे थे कि जो लोग घर में होते हैं वो नॉर्मली सनस्क्रीन नहीं लगाते, ये मान के कि बाहर तो जा नहीं रहे, धूप में एक्सपोजर है नहीं। खासकर वो महिलाएं जो हाउसवाइफ हैं या किचन में जिनका बहुत ज्यादा वक्त गुजरता है। आपने मेंशन किया था कि गैस के सामने जब हम खाना बनाते हैं और बहुत लंबा वक्त वहां गुजारते हैं तो भी हमारी स्किन को डैमेज होता है। इसीलिए सनस्क्रीन आपने बताया कि रोज लगाना है, इर्रिस्पेक्टिव कि आप बाहर जाते हैं नहीं जाते हैं। एंड अगेन क्योंकि किचन में बहुत सारा टाइम नॉर्मली महिलाएं गुजारती हैं, तो ऐसे में उन महिलाओं को आप क्या कहना चाहेंगे? बिकॉज अगेन दे आर लाइक आई डोंट work in front of a laptop, or I don't have proper screen time, etc. So why should I use sunscreen?
Yeah, generally, जो heat radiation है, that sometimes provoke melasma. So in them, the water-resistant sunscreen helps them a lot. Generally, उसमें sunscreen people apply a lotion-based or any gel-based, but in them, these kind of sunscreen won't work. So in them, I would suggest you should apply a water-resistant sunscreen, because heat के सामने there is one another thing. It's not about just the pigmentation, it's the sweating also, because sweating तो होगी ही होगी. So that's why you need a water-resistant sunscreen, and that has to be applied after every 2 to 3 hours just to prevent further progression of any pigmentation. Even though they don't have any kind of pigmentation, as we are mentioning about the melasma, they should apply it because it act as an anti-aging property also. So that's why sunscreen is so important for the skincare as well as prevention of pigmentation progression.
Very well said. And one more thing, doctor, can melasma turns into cancer?
No. The
Okay.
only answer to me is no, because this is the misconception people generally come across, and they say it can
Yes.
convert into cancer, but it does not. But yes, sun exposure, prolonged sun exposure, I'm saying, can lead to some kinds of skin cancers, which is not very common in Indian scenario.
Hmm.
By God grace, we are on the right location and right place. India is the
Right.
best for that. But yes, the skin cancers can be common due to prolonged sun exposure. So that's why sunscreen application can prevent these kind of things also.
Fair enough. And doctor, before we wind up, any take-home message for our viewers?
So as far as we are discussing about melasma, my mantra would be only the one thing is sun protection and sunscreen application, which people generally don't do it in a routine basis. The rest of the things they do it, they apply a night cream, they apply a day cream, they apply a face wash, they do home remedies, but nobody applies sunscreen in a proper way. It has to be reapplied. And yes, please consult a dermatologist. Before applying any sunscreen also, you should know your skin type. That is very important. And do not use any over-the-counter creams.
That was very short, and it was so informative that we can actually, I'm sure many of our viewers have already started searching for a dermatologist, practicing nearby them, so that they can go to them, ask them, and seek suggestions over sunscreen and start using it right away. And in case they have some patches or melasma, anything, they'll just go and consult a dermatologist from now on. Thank you so very much, Dr. Jaspal Singh Saluja, for your valuable time. As always, it was wonderful talking to you. Thank you.
Same here. Thank you so much. Thank you so much, everyone.
And we really look forward for many more such sessions with you in the coming
Yeah.
times. Thank you once again. Viewers, thank you for your active participation in today's session. Stay connected to our beautiful Spotless Skin page. Thank you. Have a good day ahead.